Good morning. My name is Anshul Falcon, and I'm joined with my colleague Nate Dreyer. We're part of the product team at Relay Health that is responsible for leading the Smart on FHIR initiatives at Relay Health, and so we're very excited to be here today with this audience to share about our progress with the first health summary viewer application that leverages FHIR and is a pilot for us to really build out our infrastructure in supporting a Smart on FHIR ecosystem and framework. So what is the health summary viewer application? Before jumping into the answer, I want to take a couple steps back to share how do we actually get the data, where is that underlying data coming from? So Relay Health has been doing a tremendous amount over the decade in HIE, patient portal, provider portal, connecting different disparate sources of data in and out of network. And so what we have here is, regardless of where that data is coming, bringing that into our Fuse data platform. So we've invested heavily in the last few years to aggregate across data types, financial data types such as claims, 837s, and clinical data type. And so as we bring these over 250 different vendor connections we support today, we need a scalable cloud platform that supports aggregation of data. So what's happening is we have data that is coming in and being normalized, treated for deduplication, curation of that data, and importantly, patient identity management. So if you're familiar with Commonwealth Health Alliance, it's a nonprofit to help vendors exchange data. Relay Health is actually a technology provider for that, and we've learned through our services there how to embellish our patient matching algorithms, and so we use that in this bottoms-up view of aggregating for matching, whether that patient is coming through from a claim data or a financial data type. And once we get through all of that, making the right data available to the right users is extremely critical. So we have 3 modes of access to data today. We support Fuse data access from a database to database transfer. We have a visualization support, which is a BI tool to have a view into the analytics and population view of the data. And why we're here today is to really focus on our Smart on FHIR ecosystem, where our first pilot is the health summary viewer, and it has really been a use case for us to build the supportability and infrastructure to have a FHIR server and FHIR API. We're using STU3. And it is currently launching within an EHR, so within Cerner's EHR, with the primary user as our physician. So I'll turn it over to Nate to walk you through the specifics of the actual application.
So why build the health summary viewer? To explain this, I'll take you through a use case for the health system in which we designed the pilot app for. So for this health system, they have a group of hospitals in one shared Relay Health HIE network, each using different EMRs. And then this health system acquires a second set of hospitals in a different HIE network. So in this example, we have John Patient who goes to a hospital in network 1. His data is shared across the network, but his data is not in network 2. Because they're on different networks, even though it's one health system. So why is this important? Well, John Patient might go to network 2, where he wasn't previously admitted. A provider or physician will attempt to access his patient data via the EMR, but John's data will not be there, which is a bad user experience for John because he has the expectation that his data will be shared across this health system. John's data is in network 1, Acme Hospital. It's not shared. So using the health summary viewer, we can plug in to the Cerner EMR, and using FHIR, we can have a view into John's data across the entire network to give basically an aggregated view of John's patient data for the physician.
So while the use case here may seem simplistic, what is the data that's actually being shown? We talked through how we aggregate data. As a part of Fuse, we've really honed in on using FHIR as our data layer for how we classify data. So if the message types are HL7, ADTs, ORUs, MDMs, and then 837s and CDAs, we take those message types across legacy systems, parse them into a FHIR resource that we call our FHIR-based ontology. And to date, the Health Summary Viewer is starting out with the clinical resources, as you can see on the screen, but we do support already our financial resources such as claim, location, and account. And the funny part is this list is growing so fast for us across our wide range of data types that using FHIR has been wonderful. The structure to extend it and nest it has worked very well to accommodate the wide ranges of data types and uses across the different settings. And so as the resource list has grown internally for us, we have a data ontology governance squad. So we joke it's the FHIR dogs to keep us in line, making sure the art of taking the science of actually what goes into care and delivery and putting it into the discrete concepts of FHIR. So a big fan of having the FHIR ontology and the resource structure in place and sharing our knowledge back to the audience and the community here of what could be improved, what next steps, what open questions still lie in the clinical model. So our Health Summary Viewer, again, has the clinical data types, and we are planning to expand it to have financial resources as well.
So quickly to take you kind of behind the scenes of what's actually happening, I'll take this pretty high level. In this example, you have Hospital B. John patient's data is accessed and launched. It's a single patient app, so John's already loaded via the EHR. At this point, both a patient and user identity token or user identifier are passed via a single token into the Health Summary Viewer. And then once the Health Summary Viewer is loaded via the iframe or the frame of the Cerner EMR, then we read the FHIR server and fetch the conformance statement. Interrogating the conformance statement, we read the OAuth 2.0 URLs, and in the next couple steps, we validate the identity token, pass the Health Summary Viewer requests the patient data via the FHIR server. Once validated, the patient data is returned and then rendered via the Health Summary Viewer HTML. So now I'll take you through a quick demo. So this is a prototype of the Health Summary Viewer that's plugged into the Cerner EMR. First, you can see right away we're jumping to the John patient's clinical information. You can see the medications, the name, direction, start, status, and author source. Author source is especially important because we're aggregating from different sources. We're providing the provider or the physician with context from where this data is actually coming from. So, and you can see Acme Hospital from the previous example. That's what we're doing there. And then you can see, let's open up immunizations, vaccines. We also have allergies, vitals, diagnoses as well. Then we can switch context and show data from the last 30 or 60 days. It just updates the data based on whatever filter is chosen. We can expand everything, and we did design this with some usability in mind. It's responsively built, so it is mobile friendly. You can collapse everything. And then we can switch context to documents and results data. Here we launch with history and physical documents open. You can see again a list of the documents and where the sources are coming from. We have discharge summaries, labs, radiology reports. We can actually take a look at John patient's history and physical document inside of the Health Summary Viewer. Oops. Collapse. And next we have labs. We want to call this out especially because this information can come from out of network. So this can come from a LabCorp or a Quest diagnostic. Okay. So that's the Health Summary Viewer.
So back to And so just to conclude with what the benefits of the application specifically have been, but also our goals in conducting this as a pilot that is live as of last month, is interoperability, but faster. So we're very experienced with connecting and stovepiping between different interfaces, but what we've realized through this initiative is how much quicker being able to bring data from another network to the EHR of where a physician is looking at the point of time to see data on their patient, that's longitudinal patient data. So bringing the in and out of network data, and with the Fuse aspect, really doing a heavy lifting on cleaning and normalizing to make the data quality reasonable, and that's something that's iterative. You're going to always have to work at it, knowing where the source systems are, how data is coming in, is it the right patient, and have that feedback loop in place. So our feature plans are twofold. One, specifically on the application, is to incorporate the lab results and documents, which was the second tab that Nate showed in the prototype, and also scale across the next phase of 5 additional hospitals within the health system. And the phase after that is to really support the 60-plus hospitals within the one health system. The reason for this is we have a lot of experience in acquiring data and scaling. We want to pressure test how FHIR stands up to that and how we can build our infrastructure to support a very large health system. And so that's one goal. The second goal, which we're excited to be here, is really sharing our Smart on FHIR program, where we want to expand to support additional applications that aren't ones that we build in-house. That's just the starting point. So loved seeing the variety of use cases yesterday and this morning. Happy to chat with folks here after the presentations. If you have questions, very interested to see how we can help build out the framework and an ecosystem, given the tremendous amount of data that's not just clinical, but also financial resources and supporting the combination of the two. So with that, thank you for your time today. Look forward to chatting with you guys and collaborating to not just scale, but scale with FHIR, and can't do that alone and want to. And if we don't do that, you really don't unleash and unlock the use of all this data. So thank you.